it looks like the tonsils are going to need to come out.
If your doctor has recommended a tonsillectomy, that means you or your child's tonsils are infected, or they are at risk of infection. Removing them will be the best treatment option for your long-term health. You can refer to the Pahoola video about how tonsillitis is diagnosed to learn more. Remember, you should follow any instructions you were given for the day of your surgery. Typically, these will include not taking blood-thinning medication like aspirin or ibuprofen. Since tonsillectomy involves anesthesia, you should not eat or drink for several hours beforehand. Tonsillectomy is a routine procedure. Although there are risks with every surgery, removing the tonsils is relatively simple and commonly performed.
So the procedure is going to be very simple. We're going to put you to sleep.
In the OR, your surgical team will prepare you for the operation. You may be given an IV for the general anesthesia, or it may be administered as gas. Once you're asleep, the surgical team will give you a breathing tube through either your nose or mouth. Next, they will use a mouth gag retractor to hold your jaw in place, so your throat can be easily accessed by the surgeon. Remember, the tonsils are oval-shaped pads of lymph tissue near the back of the throat, on either side of the uvula. There are many techniques for a tonsillectomy. Two of the most commonly performed methods are a hot tonsillectomy and a cold tonsillectomy. In a cold tonsillectomy, scalpels and other instruments are used to remove the tonsils. Forceps pull the tissue away from the throat, exposing connective tissue, which is then cut away by the surgeon. The surgeon will irrigate and suction the bleeding that occurs. After the tonsils are removed, the new wounds will be stitched for healing. In a hot tonsillectomy, the surgeon uses a specialized cautery tool to burn away the tonsils, rather than cutting them. Cauterization seals the wound as it is made and prevents excess bleeding. The throat tissue changes color as it is exposed to heat. When the tissue is thin enough, a tonsil guillotine clamp is used to sever the tonsil completely. There are benefits to both methods of tonsillectomy. Which method you undergo will depend on your surgeon. Be sure to ask questions about the technique your surgical team will be using. As the anesthesia wears off, you will begin to wake up. Your breathing tube will already be removed. The first thing you will notice is pain in your throat where your tonsils were removed. This is normal. You may be given medication to relieve the pain. After the surgery, your doctor will give you instructions for your recovery. It will take 2 to 3 weeks to heal completely. You will remain at the hospital for a short time, but you should be able to go home the same day as your tonsillectomy. Children under 3 years of age and adults with other medical conditions may be admitted to the hospital for their tonsillectomy.